My research, as part of one of my studies for my PhD, is looking at uninterrupted and interrupted sitting in people with long COVID. Um, so, just to provide a bit of a background into the research. So, since 2020, there have been 21 million cases of acute COVID-19 in the UK. So everyone's probably fairly all too well aware now of what COVID-19 is. Perhaps what people aren't so aware of is what long COVID is. So long COVID is defined as signs and symptoms that develop during or after COVID-19 infection and aren't explained by an alternative diagnosis. So this is actually a patient coined term that was sort of encompasses, as you can see on that diagram there, both post-acute COVID-19, which is basically between 4 and 12 weeks post-infection, and also ongoing symptomatic COVID-19, also known as chronic COVID, which is basically ongoing symptoms of COVID for 12 weeks or longer. Now, some of these terms are slightly interchangeable within research. So the term long COVID is sort of an umbrella term that's used to encompass all of these. Um, so long COVID in itself has an incident rate of 10%. So that's of people who have acute COVID-19. And within the UK, the latest statistics are demonstrating that 1.9 million people are currently suffering with long COVID. Interestingly enough, something that I read actually this week as part of a long COVID research group online stated that out of 957 people with long COVID in this group, 33% of those who answered a survey actually had their acute infection either between December 2019 and March 2020. So that was really that first bout of COVID before most restrictions were in place. We're saying that as part of this population anyway, a third of people with long COVID received their infection then. So that's coming up to 4 years basically now that a third of people have been suffering with these ongoing symptoms. So in terms of a bit more of the background around COVID, so there's a wide range of symptoms and severity that people are suffering with. So some research has actually demonstrated that there's up to 65 different symptoms present with people with long COVID. And some research is now trying to stratify that long COVID is actually multiple different conditions, whether that's specifically some people are suffering neurologically, cardiovascularly, or sort of cardiometabolic, etc. But some of the most common symptoms that we're seeing are fatigue, dyspnea, so sort of difficulty breathing, as well as muscle aches. And what we've seen within the research is that people with long COVID experience increases in sedentary behavior and engage in less physical activity. So as part of a secondary analysis, that was actually a follow-up survey to some of the research that James mentioned earlier in his presentation, looking at physical activity in and outside of lockdowns. There was a small cohort that reported a medical diagnosis of long COVID. And within that, 100% of that cohort reported that their long COVID symptoms significantly impacted the amount of physical activity they were able to engage with. Further, another study within my PhD has identified that through qualitative interviews, people with long COVID aren't able to engage in anywhere near as much physical activity that they were able to prior to their condition. And a lot of these people with long COVID are people who were previously fit and active and engaging in high amounts of physical activity, vigorous physical activity each week. So in terms of that sedentary behavior with long COVID, research in healthy populations has identified that sitting for as little as 2 hours can actually worsen vascular health. So I'll go into a bit more detail later on in terms of what the specifics of vascular health are. Some of it might be sort of touching upon what Eloise mentioned in her presentation, but research has also pointed towards that interrupting these bouts of sitting with light movement, even something as small as fidgeting, can actually mitigate this acute worsening of vascular health. So aim of the study that we formulated for this one was to see what the effect of interrupted compared to uninterrupted sitting was on vascular health in people with long COVID. Now, we've also looked at some cognitive function and cerebral blood flow as well, but for the purpose of this presentation, I'm going to focus on the vascular side of things. And we've also aimed to look at the difference in vascular response following these two conditions in long COVID compared to a healthy control. That healthy control we're starting to undertake data collection for currently, as we need to make sure that we had an age matched population for this. So in terms of our methods for this study, it was a randomized crossover that took part at two different locations here in Winchester and at the University of Gloucestershire as well. So we've so far collected a sample of 25 long COVID participants, and these have been medically diagnosed with long COVID. So after completing NHS ethics for this study, we've recruited through GP practices and multiple long COVID clinics in order to get a medically diagnosed sample. And some of the outcomes that we're looking at are central hemodynamics and arterial stiffness, which I'll go into shortly. So this study is looking at basically two different trials. So at one point, a participant will come into the lab and undergo baseline measures, sit for 120 minutes without any interruptions, and then undergo post measures to sort of sum it up briefly. And then their second visit, or alternatively their first visit for randomization, they'll sit for 120 minutes. However, every 30 minutes, we interrupt it with some light bits of movement. Now, it was important within this study to try and make sure, with working with a clinical population, that the movements that we did were sort of replicable. So in terms of our interruptions, sorry, just to go forward a slide there. Our interruptions were 5 sit-to-stands, 5 heel raises, and 3 minutes of self-paced walking. So we've tried to find some sort of movements there that would be able to be replicated at home and sort of mimic almost making a cup of tea while sat down watching TV or something in the evening for people. And then just to go back a couple slides there, in terms of the outcome measures that we're looking for, Eloise mentioned about arterial stiffness. So what we're looking at there is also pulse wave velocity. So for this study, we've looked at carotid femoral pulse wave velocity. So as you can see on this diagram here, we've got what's called vascular aging. So as chronologically people get older, their blood vessels also age. Other factors such as smoking, diet, and physical activity can actually also influence this as well, which basically causes an increase in blood pressure, stiffens the artery as well, which causes the blood to travel quicker throughout the vascular system. So in terms of what we've found so far, so out of the analysis of purely the long COVID cohort, we found some interesting differences in central blood pressures. So as you can see on the first two bullet points there, we've got central systolic blood pressure and central diastolic blood pressure. So as Eloise mentioned, this is blood pressure within the aorta. So this is shown to be much more sort of valid and reliable in terms of correlations to cardiovascular disease and immediate organ damage. And we've seen that irrespective of the condition that people are in, their blood pressure is actually increasing. So you can see the effect size there with just a little table on the bottom right hand side, just to remind you of the sort of values for effect sizes. So we can see that blood pressure is increasing whether they're interrupting their sitting or not. However, what we've got here is augmentation pressure, and that's actually decreasing regardless of the condition they're in. So in terms of augmentation pressure, as the left ventricle of the heart ejects blood, a waveform is basically produced, and as that travels along through the arteries, it encounters some impedance, which then reflects a waveform backwards. And it's that reflection in the waveform that augmentation pressure is. So as you can see on the diagram in the top right here, if augmentation pressure returns throughout atrial or throughout systolic pressure, it causes an increase in that systolic pressure. So P1 on that diagram would be that systolic blood pressure without the sort of additional reflection. However, because of that additional reflection in the augmentation pressure, it's caused an increase in systolic blood pressure. And what we then mean by AIX, as you can see on those time by condition effects, is basically the ratio of that augmentation pressure compared to the whole pressure. So what you can see there on the diagram, the AIX is that augmentation pressure at the top divided by pulse pressure, which is the difference between the diastolic and systolic pressure, times by 100. So we've got that ratio. And what we can actually see is that AIX is significantly decreasing more significantly in the interrupted visit compared to the uninterrupted visit. So what that basically means is that pre and post a non-interrupted visit, AIX is staying fairly similar, so it's staying quite the same. However, from pre to post in the interrupted visit, it's actually decreasing. Now, what we'd probably expect to see when looking at previous research is AIX to increase in the uninterrupted, so worsen throughout the sitting period, and stay the same within the interruption. So the interruption actually mitigates any worsening of this vascular health. So it is interesting for us at the moment in our analysis to see that AIX might actually be potentially improving throughout the interrupted sitting period. So arterial stiffness is basically improving throughout that time period, irrespective of changes in blood pressure. So what does this mean and sort of what's the point? So it means that blood pressure is increasing irrespective of interrupting sitting bouts. So whether people are getting up and taking a break, blood pressure is having that increase. Interrupting sitting seems to acutely improve arterial function in comparison to uninterrupted sitting periods. So it seems to be, irrespective of these increases in blood pressure, actually improving arterial stiffness, which is interesting and definitely warrants further research and looking into potential physiological mechanisms behind that. And a lot of this research or data that we found so far could also have a bigger impact once the healthy controls have been analysed and collected. So it'll be interesting to see once we've got through that, to see if there is actually any difference in the sitting period against the healthy control, whether people with long COVID are experiencing greater increases in blood pressure compared to people without, or whether it's very similar and perhaps guidance could be similar to that of a general population in terms of interrupting sedentary behaviour. So we're also looking to progress this study basically to look at a very similar thing, but seeing whether intensity of interruptions alter a response. So procedure-wise, we're keeping it very similar. However, we're looking at whether a low versus moderate intensity interruption has any difference on vascular health and cognitive function in people with long COVID. So throughout this current study, we've looked at sort of, self-determined walking pace and movement interruptions. That's come out about of a RPE of about 10, and we're looking to see whether we get that slightly lower at an RPE of 9 versus slightly higher at an RPE of 13, whether that sort of increase in intensity has an added effect, or whether keeping the intensity low is sort of the ceiling of effect that we'll reach in this population. Additionally, we'll be looking at the effect of blood pooling that it might have on the vascular system throughout the sitting periods. And we're looking at a 6-week intervention following on from that study as well. So seeing if people are given guidance on breaking up their sedentary behaviour, whether that has any chronic changes in their blood pressure and arterial stiffness, and whether a text message reminder every other day has any additional benefit of changes in blood pressure and arterial stiffness following 6-week intervention. So that'll be quite interesting in itself. Most of the research in sort of prolonged sitting, uninterrupted and both interrupted, doesn't actually have a sort of chronic element. So it'll be nice to see if any of the acute changes that we've seen so far and are yet to see within the long COVID cohort is seen chronically as well. Thank you for your time and thanks for listening.